थंडी खूप आहेत का सर तिकडे?
नाही हो, एवढी थंडी नाहीये. आता ही स्लाइड पुढे पुढे ढकलायची कशी?
हा?
स्लाइड.
मी काय करतो,
Sir, we are on live. Sir,
the
we are.
company. Yeah. Then I'll introduce you and then I'll start the presentation. Good evening, doctors. Welcome to this program on experience sharing program on managing PPH, case studies from labor room. We have Dr. Prasad Kulkarni, our honorable speaker for the day. This program is brought to you by Hetero Healthcare. Hetero Healthcare is an innovative pharmaceutical company with 25 years of excellence and 36 state-of-art manufacturing facilities. Hetero Healthcare has 300 plus products in portfolio and presence in 126 plus countries. 21,000 employees globally, and Hetero Healthcare is the largest closed company in India. It's among the largest of APIs and FDFs in the world. Hetero Healthcare is Asia's largest API manufacturing facility at Visakhapatnam, Andhra Pradesh. Hetero Healthcare is a 360 integration provider striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. Hetero Healthcare pioneers in quality and innovation and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. During COVID-19 pandemic era, Hetero Healthcare, the pioneers in antivirals, offered oseltamivir, favipiravir, and remdesivir to the patient, because of which in August 2020, Hetero Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar experience sharing program on managing PPH. We have got honorable speaker, as I said, Dr. Prasad Kulkarni with us. Dr. Prasad Kulkarni is MBBS, MD, Gynec, lecturer in gynecology in private practice since 1992. Sir has done basic sonography since 1993 and visiting Miraj in 2019 for IVF, visiting Kolhapur Fertility Center, basic laparoscopy, hysteroscopy from 2006, and sir is a IVF consultant. With this brief introduction, I'll hand over the session to Dr. Prasad Kulkarni. Over to you, sir. मी स्लाइड चालवतो.
Okay. Good evening, everybody. Today we will see the common problem in the labor room, that is the postpartum hemorrhage. Next. Postpartum hemorrhage is defined as at least 500 ml following blood following vaginal delivery and loss of more than 1000 ml following cesarean section operation. Postpartum hemorrhage is common and can occur even in women who are at not risk. PPH is the leading cause of maternal mortality in low-income countries and the primary cause of nearly 35 to 30% of all maternal deaths globally. So, postpartum hemorrhage, it is very unfortunate event, but it is common. It is the leading cause of maternal mortality, about 35% of all maternal deaths. And also in developing countries, it is very high maternal mortality rate, around 240 per 10, 1 lakh live births, as compared to 16 in developed countries. The global PPH incidence is around reported as 2 to 4% after vaginal delivery and 6% after cesarean section. But 38% of maternal deaths are contributed due to postpartum hemorrhage, and 25% of global deaths are take place in India, and two-thirds of these attribute to postpartum hemorrhage. India has unexpectedly high maternal death rate of 540 plus per 1 lakh live births. As everybody knows, because of the maternal age is rising, and again there is complicated pregnancy, so there is again chances of hemorrhage is rising. The common etiology of postpartum hemorrhage is uterine atony. That is, uterus this doesn't contract and the vessels are not packed inside, and the uterus start bleeding. Then there is deficiency of the thrombin in coagulopathies. Then if there is unidentified trauma, uterine trauma, injury to the birth canal, and the inversion of the uterus, or unidentified rupture, any lacerations, and another major cause is retained of placenta, clots, and abnormal invasive placenta. So, and again, the major cause nowadays is rising age of the mothers. As the other modalities of infertility, they are rising. So the mothers first delivery may be at the age of the 40, 45 with the help of the assistant reproductive technology, and the chances of invasive placenta are more high after routine cesarean section operation. Next. So the clinical findings we should assess in postpartum hemorrhage. Most of times there is abdominal tenderness, the circulatory collapse. If the circulatory collapse is rise in severe, then there is sudden patient collapse. Then sometimes if the bleeding is not identified, then increasing abdominal girth, then loss of uterine contraction, uterine atony, and we can find the maternal tachycardia, blood flow is losing, she is losing very high blood and lot of vaginal bleeding. Then we should, in the finding, we should assess the degree of the shock, whether it is a compensation 500 to 1000 ml or mild shock when there is 1000 to 500, 1500, or the moderate if the 1500 to 2000. If the even the compensation side, the clinical pictures, if you find if everything is in difficult for you, I think the first call which you should in, if it is happening at the night, you don't have any help, you should call for help, arrange blood, and I feel we should treat very aggressively the PPH because it is a birth. During the birth, the female life is must. We should take care of her life. Next. Approach towards is if the uterine tone is poor, then uterotonics we should give. Previously, methargine, prostaglandins, these are the uterotonic used. Oxytocin, prostaglandin, ergoid-ligase, methargine. Then we should check the woman thoroughly if needed under anesthesia or any uterine rupture or the extension of the uterine angles, tears during cesarean section, or there is very laceration, heavy lacerations in perineum, perineal injuries, and it is bleeding. Then we should first repair the bleeding or genital tract trauma. Then pelvic, in case of the very serious, we should go for pelvic arterial embolization, but that to be on the when everybody is available for you. But otherwise, I think the major approach should be you should arrange aggressive transfusions, aggressive blood transfusions, ask for help, and if possible, we should shift patient to the higher level. Next. Then nowadays, this new molecule is developed. It is a heat stable formulation, heat stable carbetocin. It is available in room temperature, stable formulation, and convenient while presentation. Oxytocin and alkaloid should be kept in the refrigerator as there is no need for the carbetocin. Also, the hard heat stable formulation of oxytocin is not currently available. And the previous formulation called as carbetocin should be stored between 2 to 8 degree, but now the new formulation, there is no need for the fridge. Around 30 degrees you can store. Then resource poor countries do not always have the cold chain transport and storage capability. So with the carbetocin, there is no need for refrigeration. Next. Next. Then how do you use some types of how you use uterotonic agents? Some people use at the crowning of the baby's head, like oxytocin, carbetocin, at the delivery of the anterior shoulder, or some people use at the end of the second labor as ergometrin. Following the delivery of the placenta, we use of methargine. And some people we nowadays use prophylactic use of prevention of PPH and active management of the third stage of labor. We actively deliver the placenta after separation, and sometimes we have to manage with PPH with the uterotonic agent. Next. Carbetocin is a next generation drug for PPH management. It is a synthetic long-acting analog of oxytocin. The advantage of carbetocin created by several modifications is it is a prolonged half-life, then reduces enzymatic degradation, and there is no need of fridge. One vial contains of 100 microgram of carbetocin in 1 ml solution, and we can give carbetocin in intramuscular. Next. Then the character of the carbetocin and heat stable, carbetocin and heat stable advantage, and again, it intramuscular the contraction can occur almost around 2 hours, and it is more than oxytocin. The uterus is strongly contracted, and it is most important in when we want to uh, uh, PPH, we want to avoid PPH therapeutic prophylaxis, then carbetocin is first drug of choice, what I feel. But the carbetocin is not useful of induction of labor, not augmentation, but it is most useful for prevention of PPH. But unfortunately, we cannot use when the PPH is carbetocin, we can't use after PPH. Next. After WHO champion trial has shown clearly that carbetocin is non-inferior to oxytocin, and patients this is studied enrolled more than 30,000 women across the 10 countries including India, and both oxytocin and carbetocin shows adverse events, that is sometimes death of the patient in both drugs with the carbetocin and oxytocin. But still carbetocin is better because it is a long-term use after intramuscular and gives strong contractions, and loss is postpartum loss is at least less than oxytocin. Next. Oxytocin, now this chart clearly shows efficacy between carbetocin and oxytocin. The loss is equivalent, and loss more than 1 liter, they are also equivalent with carbetocin and oxytocin, and at least unanticipated evident adverse incidents occur in both things, and safety is also similar. So the frequency of blood loss at least 500 ml with the use of additional carbetocin was proven to be non-inferior versus oxytocin, and the use of uteronic agents intervention to stop bleeding and adverse effects did not differ significantly between these two groups, oxytocin and carbetocin. So the world champion WHO champion trial has conclusion that carbetocin was non-inferior to oxytocin for the prevention of blood loss at least 500 ml or the use of additional uterotonic agents. Also, the Cochrane review, this also helps in this formulation, because the woman undergo cesarean section, carbetocin resulted statistically significant reduction in the need of therapeutic uterotonics compared to oxytocin. Also, carbetocin is associated with less blood loss as compared to oxytocin in the prevention of PPH. We have vaginal deliveries and associated with significantly fewer adverse effects. So the recommendations guideline benefits carbetocin for preventing uterine atony. The WHO in 2018 has advised also Obstetric Society of Canada, the carbetocin 100 microgram IV bolus is advised. New Zealand Society, Gynec Society has also advised carbetocin for active management of third stage of labor. Even FIGO has advised carbetocin recommendation for prevention of PPH management. Germany, Austria, and Swiss obstetric bodies have also advised carbetocin 100 microgram slowly IV. Then France Gynec Society also carbetocin has proved non-inferiority to oxytocin by champion trial. Now I will share my experience with carbetocin. It is a smarter, superior, and safer choice in PPH thing, PPH
Since how
management.
long you have been using, sir, carbetocin?
Sir, carbetocin I am using when it is introduced.
Okay,
So around I think 8-10 years.
18 years. And
Uh,
what is your overall experience?
the overall experience I will share. That is, sometimes nowadays the people, as I said, ki assisted reproduction, because the maternal age is rising, then they are obese,
Oh,
they are anxious, and
correct,
also they are very hefty.
correct,
Again, when we start her section or thing, she is very anxious for everything, and her pulse is rising like anything. So we have stopped using this prostaglandins. Absolutely. Sometimes most of the people have some allergic problem or thing, but
correct,
whenever we put the incision, take the first we I try to hit the baby, then most of the times our anesthetic put her in the intramuscular. I feel intramuscular is much more better.
correct.
And the already patient is anal spinal, so the intramuscular she may not feel also.
Pain.
Okay, yeah. And in open axillary, and another thing is when during normal delivery, there is oxytocin drip is if still we push it is intramuscular. I feel it is a safer thing because it lasts long time. What I feel.
Longer time. The duration is
Yeah,
longer.
it lasts uterine contraction stops longer time. What I feel. Then we remove placenta. Only thing is we should remove the placenta, check the laceration immediately. But the
Correct.
for seizure, there is no tachycardia, prostaglandins or no bronchospasm. That is what I feel in theater.
Yes, 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 yes.
No
And
bronchospasm.
patients many times don't give their past history properly.
Yeah. And the sudden bronchospasm is also known. And then for the small theaters, for the small clinic, first thing
Eh,
whether we are
impossible.
landing in pulmonary edema, we are landing in any other problem, bolus,
Correct.
pulmonary embolus, or like this that we feel. Yeah. So
Coming to
that is
some
why
of
I
these
feel
questions.
at least and twin delivery is also increasing
Twin
because
delivery.
of assisted reproduction.
Yeah, yeah, yeah. Barabar.
And
And in
then
dilatation of uterus again.
yeah, dilatation of uterus this, and whenever there is another I think observe sir is whenever there is sometimes fibroid is there or it is
Hmm.
there, because I tried this year, last time I have not this tried. Yeah, I tried elderly patient, and around 8-10 centimeter fibroid is there.
Oh, oh,
And her age is 40-41.
Bapre.
So now she, and I have to
Oh,
deliver her, but I deliver her. Again, I put this. I sutured first her. I sutured scar, uterine scar, and then I removed her fibroid. But even this
okay.
thing also, I was very comfortable with carbetocin.
Carbetocin.
Yeah,
And
yeah,
at what
because
stage you give for
1
prevention
year,
of people?
because that was one my experience measure, and
Correct.
because the lady was 41 years. Again, assisted reproduction.
Bapre.
Nowadays, sir, I have read in some European literature or American literature that maternal mortality rate in United States is increasing
Because of?
because of mother's age is increasing.
Bapre. Correct, correct, correct.
Mother age
Did
is increasing, and this is ethnic variations. म्हणजे Asian looks, because the Asian are thin built, reserve is less. They don't listen to doctor. This is the major
नाही.
another common cause.
सगळे गुगलवाले असतात.
And another, this is another reason because the proper diet, they don't take proper diet even in states. That is what I
No, no,
feel.
no, no.
Asian people they behave like this, and they again they are very fond of American visa, so they want delivery in US,
Yes, yes, yes.
and the other because of their educational qualification and other things, maternal age is rising like anything.
This is a problem.
Yeah,
And they
so
postpone the
uh,
delivery,
they postpone the delivery, and
postpone the
by the
pregnancy.
time when
Yes.
they age, at this age, the European they are fit, Americans some they are fit,
Yeah,
but
yeah.
we Asians we are not fit because our
We
vessels
don't.
are less, our cardiac reserve is
Correct.
less. and your renal
Yes.
liver is less, what I feel.
25, 30 is a good age for pregnancy.
Yeah, yeah.
Yes.
Ideal, what we learn is 19 is ideal.
Yes.
Yes. Holland and Bruce has said 19, first delivery is 19, between 19
Correct.
to 23 is the ideal period.
First.
It is not possible.
नाही नाही आता शक्य नाही ते.
Yeah, आता
आता
शक्य नाही.
30च्या आत झालं तरी खूप झालं.
Yeah, it's a lot of things because everybody is now, even India, the female partners, they are also not ready for things. They are
Oh.
studying. They want their more
Working,
investment,
everyone
more
is
things.
working now.
Uh,
Career.
everybody is achieving behind the
Yeah.
achievement. Yeah.
It's coming to some of these questions.
Yeah.
So if you use carbetocin as a first line of drug to prevent PPH, it's a great advantage, no?
Yeah. The basic advantage I feel is it is a long acting. Then there is very less chance for any side effects as compared
Side
to
effects.
prostaglandins and methergine.
Yes.
Even sir, I have done work invasive placenta like 6 months before,
Okay.
but our interventional radiologist has blocked the thing immediately before.
Oh,
But still, the our anesthetic was said you should ready for hysterectomy at any time. We don't know what is happening.
correct.
But I said, we don't worry, we'll give carbetocin first. And first there was this little gush because whenever I started incision on uterus, he pushed his drug
Yes.
in the catheter, and immediately there started gush because
Oh,
anteriorly placenta was anteriorly. But when the baby delivered, by that time all the vessels were contracted like anything.
carbetocin acted.
And the placenta, we remove the placenta intact. There is no hysterectomy.
That is great, huh? हे great आहे. हे
Yeah,
म्हणजे खरंच,
yeah, hmm,
this is really good.
yeah.
But what benefit it is to the patient will not understand what it is.
The
Hmm.
benefit is carbetocin is the basically patient side effects are there is no side effect.
Yes.
There is chance for
आणि आमचं
less
मी
blood
सांगितलं this case,
transfusion.
this type of case, yes, this type of case, carbetocin helps. Now it gives a great advantage to the patient.
Yeah, yeah, great advantage because we have saved her
Hysterectomy केवढा
uterus.
वेळ पडणार?
We have saved her uterus
Yes.
because young lady, 30 years,
Yes, correct.
and she
Correct.
has her first was Caesar,
Ah,
second was treated as incomplete abortion, and in Kolhapur they opened her and they found it is a sometimes placental problem, but they have not told her clearly. But I
okay.
suspect it is probably invasive placenta.
Placenta.
So we started from whenever there is UPT positive, I started Ecosprin 150 directly, and we'll wait.
Correct.
Yeah.
And again, that ecosprin and this also comes in the way of clotting, no?
Yeah, yeah. In
Yes,
fact,
yes.
Ecospin, we stop and live 3 to 4 days before.
Yeah,
And
yeah.
because 33, 34, we don't go ahead again that because it
Correct.
stands, if she lands in labor, then again everything will be horrible.
Absolutely.
So 34, 35 weeks, we delivered her
Yeah.
our institute, multi-specialty hospital with the international radiologist.
Barabar.
Uh,
Although we say what patient profiles we can anticipate PPH, खरं म्हणजे झालं, you can anticipate PPH in any patient, anytime.
Basically, you should anticipate in any pipette, but whenever there is very distension, large distension of the
Hmm.
abdomen,
Hmm.
whenever there is preterm labor, I don't know why preterm labor is there again for PPH, but sometimes they go. Whenever labor is prolonged, and even if the after surgery there is again chance of the PPH, we don't know why.
So anemia must be a major risk factor,
Yeah,
no, for this.
anemia must be the major thing. And there is a blood clotting problem. If she is
Yes.
having some blood thinning medications, she
Yeah,
is
yeah.
on long-term ecosprin or low
Correct.
heparin, then again there is a problem. And
One of the major problem आपल्याकडे patients don't share the data with the doctor.
they don't share the data. Basically,
Past history सांगतात नाही.
for them, delivery is a, like a dressing. Yes, we come for
Correct.
dressing in the hospital, your hospital. They feel
Correct.
like this is where I come for dressing and why this is sure. And the government is behind us like we are criminals. Uh,
Difficult to stop the job, really. Any experience in RH negative mothers, sir?
yeah, we can use. I don't think
No, there should not be.
no issue.
And you have already answered this. I don't want to take
Yeah,
much.
this
You generally
prevention.
prefer IM route ना, पण IV कुठे वापरलं स्कोप
हा
असतो IV?
IV वापरते when there is a cesarean section started and anesthetic is there, somebody is there, something. Then we
To
prefer
monitor.
IV over. हा
बिकॉज अनालिसिस नसतं मॉनिटर करायला कोणच नसतं विथ IV ड्रिप गोईंग ना. Yes.
लेबर मध्ये आम्ही ग्लोव्ह घालून बसलेलो तिकडे कोण मॉनिटर करत असेल?
बरोबर.
मॉनिटर आकडे दिसत असतात तेवढं.
आणि साईड इफेक्ट्स कर काही?
Fortunately, I have not still any
बरं.
have seen carbohydrate side effects.
फर्स्ट ऑफ ऑल PPH is such a problem and add to that साईड इफेक्ट
हा,
असेल तर आणि प्रॉब्लेम.
नाही, I have not seen
गुड.
side effects.
Suppose if the patient doesn't respond with carbetocin, what you add?
Then I
म्हणजे कार्बेटोसिन
personally,
दिल्यानंतर
I would personally prefer prostaglandins.
येस.
But even after the prostaglandins, then this is not acting. Then we add methargin.
करेक्ट.
Yeah, carboprosin we use.
Advantage of कार्बेटोसिन or other I think storage condition नाही is a major advantage I
The
feel.
storage because it is for our country. It is, and I think
Yeah,
they are also
difficult, very
cheaper.
difficult.
They are better cheaper, I think, as compared to other things.
And transport is आपल्याला we don't know whether cold chain is maintained or what.
But we don't know anything
Even
because
power outage
nowadays
is
the
common in Mumbai
drugs are
also.
also coming like Amazon style delivery.
Yeah.
We
You
don't
don't
know
know
whether
stability वगैरह.
even for the hormones is the same story. We don't know how is the.
Correct. Should it be kept as a reserve drug or a first line? तुम्ही तर first line च वापरतात.
I use personally.
Yes. And sir, overall your take home message for the audience ज्याने अटेंड केलं त्यांच्यासाठी.
मला असं वाटतं की कार्बेटोसिन इज अ व्हेरी सेफ ड्रग एज पर माय एक्सपिरियन्स. सेकंड थिंग, when we are in the tier 3 cities or small clinics, we have got limited resources. Even there is no relative. Most of the times, one old lady or one man is there outside you. We have got
Correct.
2 staffs, and most of the times these incidents occur at night. So,
Yeah.
so what I feel is carbodosin we should use. We should wait for half an hour. Pulse is okay, then go to sleep. That is what I feel.
Thank you,
Wait,
sir. You know, your
wait
experience
after
is.
delivery for half an hour. This is the basic message
Yeah,
for
correct.
because
And I'm
the
sure.
rules are very difficult. Government
Correct.
will treat you more than criminals if the lady died in your clinic. This is the take-home message.
Yes, correct.
So first thing, ask for carbotation and ask for help.
Help, correct.
First thing is ask for help. Nowadays, everybody is mobile. Ask for compounder to call 2 4 people. Ask for them to help. This is the thing.
Correct.
Ask for help because clinics are single doctor, single man.
Yeah.
What we can do.
Thanks, doctor. I'm sure doctors have benefited attending this. I'm very sure. Thanks for sharing your experience. काय होतं इंटरनॅशनल आर्टिकल्स वगैरे वाचण्यापेक्षा टेस्टिंग द आय मीन रिडिंग
हा.
और हिअरिंग डॉक्टर्स एक्सपिरियन्स इज मोर
आणि
रिअश्युरिंग,
मला असं
मोर
वाटतं
कॉन्फिडंट.
की नावडेज हे जे लोक आहेत त्यांनी म्हणजे आता जे प्रॅक्टिशनर आहेत त्यांनी मिसॅप्स बघितलेल्याच नाहीये. त्यांना सगळं
करेक्ट.
पुढी प्रॅक्टिस वाटतंय तर तसं नाहीये. आणि डोंट बिलीव्ह ओनली इन मॉनिटर्स.
करेक्ट.
You should check your own pulse.
येस.
BP स्वतः बघा. Why in your AC, why the patient has this sweating, you should assess, look her tongue, look her paleness, and then assess yourself and aggressively manage aggressively. What I feel is
Absolutely.
you should manage. This is aggressive condition management. We should.
एकही सेकंद घालवता कामा नये. करेक्ट. एव्हरी सेकंद विल मॅटर.
Hello.
एव्हरी सेकंद विल मॅटर.
Yeah,
प्रत्येक
every
क्षण.
second will matter. So ask for the help, treat aggressively.
करेक्ट.
Even if the unnecessary you feel you one transfer.
नाही, डझंट मॅटर.
Yeah, it doesn't matter.
Doesn't matter.
And you should know the blood group and whether the blood is available
Yes.
whenever there is patient for labor seizure at your hospital. This is your responsibility, not patient's responsibility.
No, correct.
Yeah, this you must know what is patient blood group, whether blood is available or not available.
Thanks so much, sir.
Okay,
बरं
thank you,
वाटलं,
sir.
मजा आली. Very nice. Thank you. You can log off, sir. Thank you.
Thank you.
Thanks all the doctors who took time and attended. Thanks marketing sales team of Itro. Thanks IT. Thanks Bhuvan. Thanks Tanvi. You can log off, sir. Thank you very much. Very good evening. Thank you. Thanks, Bhuvan. Thanks, Tanvi.
Thank you, sir. Bye, sir.